Hi, good morning. Welcome to another edition of Eye Openers, the monthly video blog for North Shore Eye Health and Wellness. I'm back with Charlotte again to talk about babies and their eye development. In the last two episodes, we've chatted a little bit about the Infancy Program, which is a federal grant that gives free eye exams to babies between the month of 6 and 12 months of age. And that's a fantastic program for parents to take part of, which we are providers here. The other thing we talked about was some of the common eye conditions that babies can run through, from pink eye to a blocked tear duct. So today we're going to talk a little bit about the visual development for the first few months of life. In particular, when babies are first born, for about the first month of life, they don't open their eyes a whole lot. And their eye movement is very sluggish, and their eyes may be all over the place. And parents are often concerned about that. And in the beginning, it's not that big of a deal. Their eye coordination is not so hot. The other thing that's really important, I think, for babies in the beginning, at about 1 month of age, their vision is pretty poor. And really, what their world is their parent's face. For about that far, that's about all they can see. As they get older, at about 3 months of age, their eye alignment starts to settle down a little bit, and their eye movements become more coordinated. We may still see some eye turns or misalignment of the eyes, but it's starting to get less and less. If eye turns continue beyond 3 months, that's something you definitely want to bring up with your eye doctor. We're definitely concerned if that's the case and want to get that addressed. At about 3 months of age, you may see that the baby is starting to reach their hand out forward to grab things. It's because their depth perception is starting to develop. Also, at about 3 months of age, their eye color will really be locked in. Their eye color can change a little bit in the beginning, but by about 3 months of age, that steel gray will kind of transition to the true color of their eye, whether that's blue, green, or brown. By the time we get to 6 months, they should be doing what we call fixating and following, meaning in a distance target or mom or dad or a mirror, like Charlie's looking at, their eyes will be locking on something and tracking that in a very coordinated manner. If they're not coordinated at this point in time, once again, you want to bring that up with your eye doctor. This is one of the reasons why the infancy exam starts at 6 months of age, because we're going to look at eye health. We're going to look at eye tracking and teaming skills, and then we're also going to look at their vision. By 6 months of age, a baby's vision is about 2100. That's not very good. That's reaching, arm's length or so away, but the baby's world, they don't need to see a whole lot more than that. By about 12 months of age, vision has improved significantly, and they're about 20/40 for vision, which essentially is drivable vision if you put it into adult terms. So they should be able to see distance, they should be able to see near, and hopefully their eyes are evenly developing and getting to a slight far-sighted prescription. We want the babies to be slightly far-sighted, which means their eyes can fine-tune their vision at all distances. So that's just kind of a general summary of how babies' visual development should be taking place. Of course, if you, as a parent, have any questions along that process, give us a call, give your eye doctor a call, and make sure you get it checked out. But I think the most important thing during the development of baby's vision is to make sure that you get them in for their infancy exam between 6 and 12 months of age. Right, Charlie? Very good. Well, thank you for joining us. Hopefully you've learned some good information. And if you, of course, have any concerns with eyes or vision for babies or adults, make sure you reach out to us. Thanks a lot.